Welcome back. Our sponsors at Spectrum Health and Human Services provide behavioral health counseling and crisis response in Western New York. And joining us now to tell us more about what they do for our community is Dawn Marie. Thanks so much for coming in today.
Thank you for having me.
Of course. Spectrum Health actually just opened a new location with a special purpose. So I'd love it if you could start by telling us about that.
Yes, we did. We are located in Riverside. We work closely with families, schools, providers to help children and young adults through anxiety, depression, life changes in a safe and supportive environment.
Nice, okay. And tell us about the advantage of having a space that is just upstairs of a pediatric practice.
Yeah, so we have had a working relationship with Allentown Pediatrics for over 10 years. So a lot of our referrals still continue to come from Allentown. It's kind of like a one-stop shop for families and parents in that they can support their child's physical and mental health all in one building. The entire building is child-oriented, so it's family-friendly.
Nice, okay. Do you want to tell us some special features of the counseling center?
Yes, so we're located directly off the 190 and we're on a bus line. All of our clinicians and prescribers have experience working with children and adolescents. We have family supports on site as well as peer supports. Our CARES crisis team is also on site, so it kind of provides an inclusive opportunity for children, adolescents, and families to receive care.
That's a big part of what makes Spectrum special. I know that it's been a big movement to be in these schools and have counseling and access to care within the schools, because it can be hard for a child to ask for help, let alone know that they need help, or for a parent to know where to go to take them. So having these services, which is what you do, correct?
Absolutely, yeah. So I'm in the Riverside Clinic 3 days a week, and I'm also in the Lancaster schools twice a week. And we have clinicians in the Williamsville schools as well.
And what are you seeing with the students as far as their mental health? What are some common things that you've been seeing trending across Western New York?
So there's definitely a trend of anxiety and depression in children and adolescents. I think social media plays a big impact on a child and adolescent's mental health.
We're heading into the holiday season now, so that's a lot of the time when the adults get really stressed, right? They're planning parties, they have in-laws coming, they have to see all these people, and it makes them a little bit stressed, and that energy can actually feed into their kids, right? So what are some good advice you have for parents or guardians to help you manage the expectations and still be able to find the joy in the holidays?
Absolutely. I think children and adolescents can certainly feed off their parents' stress level. You know, they're very mindful of what their parents' stress level is like. So I think parents can certainly be a role model for kids, basically identifying the stress and letting them know that they need a break. So plan downtime during a hectic holiday schedule.
Right.
You know, being mindful of the routine, especially for young children, being mindful of the changes in routine, identifying that for the child, letting the child know that there's going to be certain events that are extra on the calendar, you know, scheduling some family downtime. Also, kind of putting a positive spin on any disruptions. You know, if a child needs to give up their bedroom for a visiting family member, you know, present it as, oh, you get to have a sleepover in the living room, or you get to have a sleepover in your siblings' room, so that they don't feel like they're kind of put out from their own
They're like, this
bedroom.
is my house and I'm not in my bed.
Right. Also building in breaks, you know, at activities that can be overwhelming or overstimulating for a child. You know, normalize the need to go for a walk or to take a break in a quiet space.
Yeah. And what about, talking about creating boundaries with people too? I have a friend that she's decided that, you know what, for Christmas, her mom is not invited because she knows how she reacts around her mom, and she realized that that was having an effect on her kids, and she didn't want that to be part of their memories growing up. And I thought that was a really bold thing to say, but a lot of people might relate to that, right?
Absolutely. I think letting the kids know that they can still have healthy boundaries, and even though they may not have the final decision, they could certainly have a choice in who is present and where they feel comfortable.
That's right. And it's important because physical health and mental health are very much linked, aren't they?
They are, very much so. So a lot of people don't realize that anxiety and depression in children can present in a lot of physical symptoms. Oftentimes kids will complain of stomach aches, headaches, tiredness, loss of appetite, overeating. So those are all kind of physical symptoms of mental health issues for kids.
What is the best way for our viewers to reach out to Spectrum if they could use your help or would like some tips or maybe want to get their family involved?
Absolutely. So our intake number for an assessment appointment is 716-539-5500, or you can visit our website at www.shswny.org.
Alrighty, Dawn Marie, thank you so much for giving us some great tips going into the holiday season. Viewers, with the holidays approaching, you want to make sure you're taking care of yourself so that you can find joy in the season. Our sponsors at Spectrum Health and Human Services can help. To learn more about their physical health and mental wellness services, just visit shswny.org. Thanks again for coming in.
Thank you.